This is going to be awesome, and I want to encourage everybody not to be shy, to go ahead and speak up if you have questions or put them in the chat, because I want to get to everybody's questions. And with that, I'm going to put the PowerPoint up here. All right. Sorry, I'm just arranging all the boxes so I can see the chat as it comes up. Awesome. All right. You guys can all see that? Thank you. I am curious. I had a great introduction. Thank you. I am curious who you guys are. Your name, where you go to school, where you work. And I'm particularly interested in any questions that you might have, because I really want to make certain that I'm answering everything that you guys want to know, because there's a lot of things to talk about in this process. And I want to make certain that everything is answered. So if you guys want to put that in the chat box, that would be awesome.
And we are also recording this session, just so everyone knows, so that people who have class or who can't make it today, but just want to make sure you know that this is being recorded in the spirit of learning. So just didn't want you to be surprised.
Thank you for that. Okay. And so why we are here, we're here to learn about the process of being an LPC. So what exactly is an LPC? It's a licensed professional counselor. You're allowed in the state of Connecticut to engage in counseling as an independent practitioner. That means you've met some minimum standards for preparation, that you follow some ethical standards, the ACA ethical standards. You follow the Connecticut state laws as they pertain to counseling, and you engage in annual continuing education. All right, so what are the benefits of having your LPC and being a school counselor? Credibility. You clearly have counseling skills. There is not a lot of doubt about that, because you have the credential from the state of Connecticut that attests to that. It can make you easier to hire, because you clearly have counseling skills that are in demand. It gives you flexibility, extra income if you desire, and job security. And quite honestly, sometimes it just feels good to know you have options. I always joke around with my coworkers, there are 2 times every year I quit. Scheduling at the beginning of the year and scheduling at the end of the year. And while I don't actually quit, it makes me feel really good to know that if I really ever had enough, I'm easily going to go find another job. So that for me is a real big benefit of having my LPC. So how do you get there? The first step, obviously I should say the first step is to graduate. But your first step on the path to getting your LPC is to become an LPC A. This is new. It's the Licensed Professional Counselor Associate. It just became enacted recently due to a lot of efforts on the part of the Connecticut Counseling Association. It helps LPCs in Connecticut be on the same playing field as other mental health professionals, like maybe you guys have heard of the LMSW, the Licensed Master Social Worker. It gives us a lot of credibility, and it makes certain that we have met the minimum standards that we need. So those minimum standards are education. You have to have a graduate degree, and I'll go over what that entails. And you have to be able to pay $220 to the state of Connecticut. So there's 2 different paths to be an LPC A, which is the first step to being a fully licensed LPC. First, you graduate with a clinical mental health degree from a CACREP program. I'm guessing that if we're here, that's not our path. We're school counselors. So we can have 60 semester hours in counseling or a related field, that's us. You have to have specific coursework, a 100-hour practicum, and a 600-hour clinical mental health internship. I'm going to go over these requirements a little more in depth. So the coursework requirements. These are what the state of Connecticut wants you to have courses. And you'll find when you review this list and you look at what you're already taking in your school counseling program, a lot of this is already covered. Human growth and development, social and cultural foundations, counseling theories and techniques, group counseling, career counseling, appraisals or tests and measurements to individuals and group, research and evaluation. So most of those are in our school counseling programs already, right? Professional orientation to mental health counseling. That might be something that isn't covered in our traditional school counseling program. Addiction and substance abuse counseling, trauma and crisis counseling, those are probably covered in your school counseling program. Diagnosis and treatment of mental and emotional disorders. And that's another area that's probably not covered, or you're going to have to take classes. All right, the internship. This is the part where a lot of people have questions. This is new. So there's a 600-hour clinical mental health internship. This is in addition to your school counseling internship. And I put some math up there so you guys can see what that means in time, in terms of time that you need to spend to get this done. I'm going to ask, is there anybody in here who, as a school counselor student, has had the experience of looking for and doing a clinical mental health internship? Is there anybody in here who's had that experience? Okay. And hi, Jennifer. Would you mind? Oh, and Chelsea. Hi, Chelsea. Jennifer, Chelsea, Jordan, if one of you guys or multiple of you guys would mind sharing what that experience was like, I bet people would really like to hear that.
I can go first because I know that Chelsea and Jordan already finished there, so theirs is going to be a little more valuable than mine. Save the best for last, you know. It's good to see you again, by the way.
Thank you.
It's been good. It's thankfully because of the school counseling internship being dropped to 3 days a week, the way that I made it work is by doing the clinical mental health internship on the other 2 days of the week. And I'm basically going to school for an extra summer just to finish out that clinical internship.
Mm-hmm.
So I graduate in May, but I won't be done with both internships until August. Assuming everything goes to plan with, like, you know, the coronavirus and everything. But the way that it was initially planned was that as soon as I was done with my school internship, I would go up to full time for the rest of the summer, and that would meet the hours requirement. But it is tight. So, like, you know, there's not a lot of room for like vacations and everything. So it's definitely something that takes like dedication.
Thank you for that, and good luck.
Yeah. Thanks.
We have a question. Where did you do your clinical internship? Where are you doing that? Do you mind sharing? You don't have to share.
Yeah, no problem at all. I do mine at the Family Intervention Center in Waterbury.
Okay.
And I do my school internship at Pomperaug High School in Southbury-Middlebury. It's on the line. So.
Okay. All right. Dr. Donahue, who's in here, is a professor at Central. Hello. And she put in the chat box, it's an important thing for you guys to notice. Not all programs are allowing students to do both their school counseling and their mental health internships at the same time. So it's important for you to know what your program allows. It's a lot to take on to do those both. Chelsea, did you want to speak?
Yes, sure. Hi, Sarah. It is good to see you again as well. So actually, to kind of go with what you said for CSU students, we weren't sure at St. Joe's just because it was, when looking for my internship with St. Joe's, we wanted to make sure that it aligned properly, just like Jennifer's did. But if I was not able to do it like consecutively with my school counseling internship, I had found a site that was allowing me to either do it consecutively or to do it summer to summer. So they were flexible with me as to how I was able to do it, but I didn't want to do it summer to summer just because the lapse in time. So I did mine at Child's Guidance Clinic in Manchester, and I front loaded mine to the summer hours primarily. So I did full time in the summer. I lived off of my student loans for the summertime, and then I did 2.5 days a week in conjunction with my school counseling internship in the fall. And I just finished at the hours. Like Sarah said, it's not easy. It is a lot of work, but it was definitely worth it to me. And front loading it during the summertime was super beneficial. I was able to learn the ropes at my clinical site. And then during the fall, I was just like one of the team members doing what I had to do. And then time was up because it passed so fast.
Thank you, Chelsea. Chelsea was my amazing practicum student for one semester. She was awesome.
Yeah, well, I have to say I learned from one of the best school counselors that I've known yet, and it's because of Sarah, everyone, Miss Dr. Zalewski, that I did it. I was thinking about doing the double internship, and she was like, well, you know, it's really beneficial, and, you know, we talked about it, and then I was about it, and luckily St. Joe's was able to work with me, and a couple, Jordan and Jennifer, wanted to do it as well. And so the head of the department was like, well, let's make this happen. So we did, and that's kind of how it took off.
Thank you, Chelsea. I appreciate it.
Thanks.
Jordan, do you want to spare a quick minute and tell us about your experience?
Yeah, sure. Can you guys all hear me? Because I'm not
Sure
sure.
Can.
Okay. So I was in the same boat as Jennifer and Chelsea as well. Me and Chelsea actually did the same timing. So we both front loaded our hours in the summer, which I really enjoyed because it's a lot and everything's new. So dedicating 5 days a week in the summer to learn all of that, I think was really beneficial. And then having it overlap with only one semester of the school internship was nice because we kind of knew what we were doing at that point. So then we were able to kind of take more time for the school internship at that time. It was a little challenging to have them overlap, but then again, you're learning something new every day. So it was a really positive experience. I did my clinical internship at Rushford Center in Meriden, Connecticut. And I would highly recommend that to anyone. They're really flexible because they have a lot of programs available. So if anyone's looking, I would definitely reach out to them.
Thank you so much for that. That's super helpful. All right, what I am seeing here is some questions about people who have graduated already. I think someone said 2009, and they're wondering now at this point, what does it entail to get your LPC? There was a window of time where if you had already graduated, you didn't have to go through the clinical mental health internship, but with the LPCA and their requirements for that, it appears that that exemption is gone. There is no exemption that I have seen in the LPCA legislation that says if you graduated way back when, you can still go forward. And you cannot practice anymore in the state of Connecticut without a counseling licensure. You used to be counselors before you got your LPC. You did some postgraduate time with no credential at all, and that was okay. But now that they've instituted the LPCA, that's no longer okay. You need to have that credential. You can contact the Department of Public Health by email and see what they say. But my reading of the legislation for the LPCA is that that window has gone, that you have to meet these requirements. And if someone finds out differently, forward that email to me because I would love to see it. Okay. So what do you do once you have your LPCA? Remember, you just need to graduate and do that internship. So you can work in an agency as a counselor. You need to accumulate, and I'll talk more about this, 3,000 hours of supervised service, supervised counseling time before you can go to your full LPC. As an LPCA, insurance companies are not going to allow you to bill them. You could potentially work in private practice with your LPCA if it was a cash only and you had supervision. You have to be supervised as an LPCA by another clinician. This is your time where you're really growing and learning a lot of important things. As your LPCA, you are going to be studying for your licensure exam if you haven't taken that already. And you will need every year to complete annual CEUs. So what are CEUs? Continuing education units. Both LPCs and LPCAs need to complete 15 hours every year. You need an hour annually on cultural competency, 2 hours on veterans and family members of veterans, and 3 hours of ethics training. So it's super important to make certain that you are following all of these requirements as when you have your LPCA and your LPC, because otherwise you're putting your license at risk. So really have a good way to keep track. I have a spreadsheet and I have a file online where I upload all my certificates. So no matter what, I can always find them. Getting the CEUs, if you are a member of ACA, which if you're going to be a clinical counselor, I really think you should, you get 12 hours every year of free CEUs. And actually this year it's more because with the COVID thing, they gave us an extra package. So if you're a member of ACA, that'll help. The veterans training, the VA has online veterans training. That's free. So supervision requirements. Once you have your LPCA, you have that 3,000 hours of postgraduate experience. So that means your internship hours don't count for this. It's only postgraduate. You're under professional supervision, including a minimum of 100 hours of direct professional supervision. And remember, that says a minimum. I highly encourage you to take more than the minimum. Supervision is incredibly helpful. And this has to happen over a period of not less than 2 years. So what is supervision? What does this mean? So supervision is when you have a more experienced counselor who is guiding and reviewing things and generally looking over everything that you're doing as a lesser experienced counselor. And that would include things like your paperwork. And I'm going to tell you the paperwork that you need to keep on your clients as a clinical counselor is vastly different than the paperwork you need to keep as a school counselor, which is fairly minimal. It's a whole different world when you go into clinical counseling. So having someone go over your paperwork can only be helpful. You're going to review with your supervisor how you're treating your clients, how you're conceptualizing their problems. You're going to talk about things like self-care. You're going to talk about professional ethics. The main goal of supervision being to make certain that your clients are safe, that you're not doing anything that could put a client in danger. And your supervisor does have the ethical responsibility to report you if you are. Scary. Most supervisors are going to work with you first, because remember, we're doing this to help people, right? And that means helping our clients and our supervisees. Our secondary goals are to increase the clinical skills. So you want to learn what you're doing and you want to really know what you're doing. So at the end of those 3,000 hours, you can go off and have a wonderful career as a counselor with a really good foundation. This is the time where you want to experience any things that would be uncomfortable or unknown as during your supervision time or your internship, where you have that support. There is training. Supervisors are able to get training. There are theories of supervision that we use. An important credential to look for if you're looking for a very good, well-trained supervisor is the ACS. That's the Approved Clinical Supervisor credential. And that lets you know that your supervisor has had training in supervision, is aware of supervision theories, and has had supervision of their supervision, which is important. So where can you get this? If you are super lucky, someone where you work will give you supervision for free. Otherwise, you may end up paying someone for supervision. The people who can supervise you, there's a lot of different people who can supervise you. An LPC, obviously, but not so obviously, a licensed marriage and family therapist, a licensed clinical social worker, psychologist, psychiatrist, or an APRN, a mental health APRN. And the Connecticut law says it has to be face-to-face consultation, which if it was me and someone else in the Zoom room right now, that's face-to-face. But it has to be one supervisor and one person. So group supervision is awesome to get. And actually, I think it's really helpful to have group supervision because you're gaining from everyone else's experience. But your 100 hours need to be one-on-one by the Connecticut law. And you need to meet not less than monthly. So at the beginning, I actually recommend if you can meet every week with your supervisor, that is absolutely the best. And if you can have a supervisor who's flexible enough that when you're reaching a point where you just are confused and you're not certain, that you can call them and they will get you in sooner, that's even better. Varisha, yes, if your school counselor has an LPC, they can supervise you. Absolutely. According to Connecticut statute, if your supervisor is responsible for a written evaluation and assessment, that needs to be in their file. Weirdly, the state doesn't ask you to turn that in. But if they are ever to audit that file, you would lose your license and your supervisor could lose their license. So that needs to happen. Millie, mental health internship postgrad? Absolutely. You can sign up, go to your college, whichever one you're choosing, and you can absolutely do your internship as postgraduate. And I think there are a lot of people planning to do that just because financially it's easier. Good question. Sure, Joanna, we can do that. Remind me if I forget. Yeah, Millie, to do the internship, you would have to go back. And every school, every college has a different process for that. And you might find when you look at the courses that you've taken that you still have some courses that you need to take to meet the requirements. Or you might not have the 60 credits, depending. So sitting down with someone from the college that you would choose and going over this would be really important. 72 credits, that's awesome. All right, to get your LPC, you got to sit for what I called when I was getting ready for it, that big honking exam. It is put on by the NBCC, the National Board for Certified Counselors. And you have two options. You have the NCE, the National Counselor Exam, and the MCMHC. You can take both if you want. They're about $300 each. But you probably don't want to do that because they're about $300 each. What you want to do when you're deciding which exam to sit for is think about your future plans. If you are certain that you want to go to, I don't know, I can't think of a state right now, but another state, you want to look and find what their requirements are. Some states require the MCMHC. Some states require the NCE. And then you have states like Connecticut who really don't care. You just have to take one and pass it. And they're pass-fail. Do I know which one New York requires? I sure don't. I'm sorry. I was trying to remember as I was saying that because I looked at some states earlier, but right now it's, sorry. But New York should be pretty easy to look up online. New York Clinical Mental Health Counselor licensure, and every state will list it. And actually ACA has a spreadsheet that you can download from their website that should give you most of the states, or a web page, I think it is now. So here's what you need in order to sit for one of the big honkin' exams. You need your master's degree. And your coursework has to cover 9 content areas. I'm not going to read them to you. They're up there. Which, if you're graduating and meeting the Connecticut state licensure requirements, you're going to be okay. Sometimes you can take the NCE right around the time of your graduation on campus. Obviously, I don't think that's happening this semester. Oh, thanks, Joanna. All right, so the NCE, what does it look like? It's 200 and multiple choice questions. 160 of those are important, they count, and 40 of them don't count. But they don't tell you which ones count, and they don't tell you which ones don't count. So you have to treat them all as important. You get 3 hours and 45 minutes to sit and complete this. They have just redone the NCE, and these are the new layouts of the questions. Professional practice and ethics are 19 questions. Intake assessment diagnosis, 19. Areas of clinical focus, 47 items. Treatment planning, 14. Counseling skills and interventions, 48 items. And core counseling attributes, 13 items. This is all on the NBCC website. And they did an analysis of the duties and the jobs that a clinical counselor does and designed the exam to cover, as you can see, counseling skills and intervention and areas of clinical focus are the biggest ones. And that is what you spend the majority of your time doing. You don't spend a lot of time treatment planning. Intake assessment diagnosis, that's again a short amount of time. I'll get there, Nancy. But yes, the answer is yes, tons of them. The MCMHC is a different kind of exam completely. This has clinical, like case studies, clinical simulations. They give you a piece, they ask you to answer a question, and then they give you another little bit of information, then ask you to answer another question. They are currently in the process of revising. I looked at the website last night, and it says that there should be information within the next 2 weeks as to what the new NCMHC. However, the domains down here at the bottom, those are from the new one. It's the layout itself, the clinical simulations with 5 to 10 questions that may be changing. It will still be a clinical simulation based exam from what I understand. So taking it, make sure you sleep the night before and eat your breakfast. And don't bring anything with you when you go take the test other than your license and I think maybe a pencil, car keys, because you got to get there. You have to take it, if you're not taking it on your college campus, you're going to take it at Pearson View. And they go over you with a wand, a metal detector wand to make sure you're not sneaking anything in. They make you turn your pockets inside and out. They're really serious about this. And it's on a computer, which I thought was really helpful rather than pencil and paper, but it was stressful. And I think the process makes it more stressful, and not knowing it in advance makes it really stressful. So know this, it's not horrible. Once you sit down to it, if you have paid attention and you know your stuff, you're gonna be okay. So test prep, how do you prepare? What's the study guides? I would encourage everybody to get Rosenthal's Encyclopedia of Counseling. It's yellow and purple. I mean, white and purple. Whoa, sorry, lost my colors. It's super helpful. The Rosenthal also has some audio CDs. I don't think those have gone digital yet, but when I took it, that was one of the most helpful things. I just put it in when I was driving around in the car and just listen to it. And it's not dry. It's actually interesting to listen to. So I would check into those. There are tons of online practice tests. Go online and Google whichever exam you want to take and then the words practice tests, and you will find a lot. Nationalcounselingexam.com has been around for a while, and they have practice tests. Yes, Millie, there are flashcards you can load on your phone. Those are awesome. AATBS, and I don't remember what that stands for right now, but they have a lot of information too, and they actually have flashcards you can buy, physical flashcards, and I had those. I didn't use those nearly as much as the CDs and the encyclopedia, but there's a lot of information out there and a lot of ways to prepare. And if you go to the NBCC website, they will also link you to other test preps, and they have their own, which isn't very detailed, but it's better than nothing, and it's free. All right, so once you get where you have met the education requirements, which you know you have because you're an LPCA before you can be an LPC, you met your supervision requirements. Thank you, Kevin. And you've passed your examination, then you can apply to be an LPC. So that costs you $315. And it costs you $315 every year when you renew. It's painful to write that check, but it's well worth it. So congratulations, now you're an LPC. Hooray! Wish it were that easy, right? So what are you going to do with it? Well, you can work in private practice, which is what I do. Although I have done other things. Things to think about. You have a lot of expenses when you're working in private practice. You have to get liability insurance. And I'm going to tell you, even if you're working in an agency that tells you that they have liability insurance, that insurance is designed to cover them. You want to have your very own liability insurance, no matter where you're practicing. And if you practice for a few years as an LPC and then decide you're not going to, you still need to look at your policy, and you may need to renew it for the next couple of years, because some policies cover events that happened while you had the policy, and some policies cover anything that pops up has to be dealt with during the policy period. So there's two different ways of that those policies are written. So you need to read and know what your policy says. And when you look at your policies, most of the common limits are 1 million, 3 million, 2 million, 4 million. Like, they're mind-blowing, the limits on these policies. Expect that, and that's what you should be looking for, minimum 1.3. You have to consider if you're going to be in private practice, if you're going to have an LLC. That's a limited liability company. It protects some of your, it separates, it creates a measure of separation from your personal finances, your personal world, and your professional finances in your professional world. I incorporated, it was easy. The state of Connecticut, there's just some things you do online and zap it away and it's gone. You do need to get an EIN because you don't want to put your social security on a lot of numbers, your social security number on a lot of things. So you get an EIN, which is an employer identification number. Again, get it online from the IRS. And I would advise you consult with your tax preparer, consult with an attorney, and make certain that you're doing all the steps you need to do to cover yourself, if indeed you think that's the direction you're heading in. More expenses, accounting and taxes. If you're doing it part-time, it's really not such a big deal as far as accounting goes. With that said, I don't do my own taxes because it's scary. But if you're more comfortable, you probably can do that. But definitely, if you're planning on doing it more than part-time, you definitely want to consult with an accountant, at least to set up your books properly and figure out taxes, because you don't want to find out after a year has gone by that you should have been paying taxes for the last year every 3 months, and now you don't have that money. Advertising expenses. This one is you don't have to spend a lot of money for advertising unless you really want to. All I do for advertising is I maintain a website. I use G Suite through Google. I pay $6 a month. That's easy. And I put a profile page on Psychology Today, where if you've ever Googled looking for a counselor, you'll see that popping up. That is one of the most common referral sources. Expenses, space, rent. A lot of people in private practice who are doing it part-time will share spaces with other people. There are actually places set up that are designed for people. You rent rooms by the hour to meet with your clients or do whatever. So that's something to look into. Or you can choose my model where I started out. I did not have any office space. I went to the home and I worked with my kids that I worked with in private practice and their families. And I didn't keep an office because offices are expensive. And for the number of clients I wanted to have, you know, 5 or 6, for 5 or 6 hours, did I want to pay for rent? No. Because when you're paying for rent, you also have to pay for things like insurance, internet. You have to think of all those things. Your liability insurance covers you as a counselor, but you need insurance on your space. So if someone trips and falls, or, you know, the potty monster gets them and drags them in, or whatever happens, that you're covered. So space can be tricky. I really like going into homes, and I found that was really helpful. If you have a space, you need to decorate it. You need furniture. And even if you don't have a space, you need stuff. So you should think about the stuff you're going to need. And this stuff may be, obviously, your licensure. What, Kylie? Do you advise not practicing in your own home?
Yeah, like you were talking about space and like renting a space. Like if you have like an office in your own home, that would be like separate from your like living space. Do you advise just like not having clients there at all? Or
actually, Kylie, one of my home improvement on the honey-do list is to take a part of my house and do that with it. I think it's fabulous if you screen your clients first, which that's common sense anyways. If you have a separate entrance, and this, so that they're not like walking through your house, because I don't know, maybe you're better than I am, but my house is not always spotless, and I don't need my clients judging my housekeeping skills or the horrible things that I cook in the kitchen. I just don't need that. So if you have a separate entrance, if you have a separate place, if you're going to be working with kids, you definitely need a place where their parents can hang out. If you're not and you time it right, then you don't need a waiting room. But if you're working with kids, you need a spot for the parents to be, and a bathroom that your clients can use where they're not going to encounter other people. That's what I would advise as a bare minimum. And you're also going to have to talk to your homeowners, because some homeowners insurances really frown on that, and some really don't care, and some will let you do whatever you want as long as you pay them extra. So you really need to look into your policy and what that covers or doesn't cover. But I think it's perfectly fine to practice out of your own house. There are people, Kylie, that don't agree with me. And that's okay. That's their comfort level. It's up to you and your comfort level. I wouldn't advise it if you're working with recently released people from jail, or, you know, a high risk population, borderline. I wouldn't want them showing up at my door. But you know what you're doing, and think about those things. All right, what was I saying? Your stuff. You need stuff. I have a huge bag of stuff I take from house to house. I have toys. I have sometimes toys I leave with the kids, like little fidgets, little itty bitty notebooks. Anytime I find them at the dollar store on sale, I give to kids for journaling. So stuff, you're gonna have to spend money on that. So there's a lot of money you're spending in private practice, but there's a lot of benefit too. First, all the money you get is yours. You don't have to pay someone else. Other than the people I listed, the expenses, everything else is yours. You don't have to share. And the flexibility. There is no one telling you, you have to work this day, this hour. No, you work when it is convenient for you and your clients, with the caveat that it does have to be convenient for your clients or you won't have any. Problems and issues to think about with private practice. All the money is yours and all the responsibility is yours. So if you're working with a high risk population, be prepared to handle some of the ramifications that might happen. You need to make certain that you have a good attorney, you have a good malpractice policy. And these are just things that you're aware of and that you're being careful and using common sense. You know, common sense is not necessarily common, but if you have a good stock of it, you'll be fine. You need to have backup. You need to have another counselor where should you get COVID and you need to take a few weeks to yourself, or maybe a month or two, or God forbid, you're never coming back. You need to have someone who can step in and take over your clients for you, because you can't abandon them. That's unethical. And then you need to account for supervision, because even the most experienced counselors every now and then run into a client or a situation where they just need to be able to talk about it with someone else, or a client who they're dealing with that's bringing up feelings or issues from their own stuff. I mean, we all have stuff, right? Because we're all humans. And sometimes you have to talk that out in supervision. So that's private practice. Another option is you go to an agency and work. And this seems, on the face of it, maybe sometimes easier. You have to decide where you want to work, what kind of agency. There are small ones, and there are really huge ones like Wheeler. They're everywhere. Think about the specialty. And you should think about that anyways. Where do you feel called to? I definitely work with kids. That's my thing. Some people are super specific. They work with kids with eating disorders. If you have that specificity and that experience and that training, and this is your area and you're really good at it, that really helps you get referrals. So think about that no matter what you do. Again, if you're going to work in an agency, you need your insurance. You need your own malpractice insurance, because again, the agency's insurance covers the agency. You want it to cover you. The benefit of working in an agency, you have consistent pay. You're going to work 10 hours this week and you're going to get paid for 10 hours this week. That's pretty consistent. Sometimes in private practice, you can go a week or two where your clients are like, yeah, I don't really need to see you. Okay. And then you can go a week or two where everybody wants to see you multiple times a week. It just comes and goes. Benefit of agency work, the responsibility belongs to someone else. You are not making the tough decisions about advertising, which clients to take, protocols. That's someone else's problem. You show up, you do your counseling, you leave. They worry about billing, they worry about all that stuff. Issues that you might run into in an agency, pay. Sometimes the pay isn't stellar. And you have to really consider that. Hour demands. I worked for EMPS for a while, which is mobile crisis. And one of the reasons I no longer work for EMPS, because I really did enjoy it, I really did, were the hour demands, where we had to be in the office till 10 o'clock. But if someone called asking for mobile crisis at 9:59, I had to answer that phone and go out. So I could be actually with a client until midnight. And then I had to come back to the office and do paperwork, because I couldn't leave without doing certain paperwork. So God forbid you had to file a 136 and you were there. And there were nights when I left at 2 or 3 in the morning. So think about the hour demands. Really ask about those if agency work is what you're considering. And not all of them are like that. That was a weird experience. All right. So I'm wondering what questions you guys have. I just went over a ton of material. Is there anything that I didn't cover? If you pass one of the 2 exams, do you have to do your internship right away? Can you pass the exam and wait a year or 2? That is a good question. So you can say, if you're graduating from a school counseling program, you can take the exam and pass it and then wait a year or 2 to do the internship. There's no reason why not.
Okay, that was my question. If I can just clarify a little more. So I am graduating this May in school counseling from WestCon, and I have no idea what the job situation is going to be for next year, but I'm hoping for something. But my question basically would be, doing an internship this summer seems like it could possibly be not feasible. And then next summer, I'm getting married. So that was really my question. If you can wait, thank you. If you can wait and push that internship off.
You sure can.
Okay.
You sure can. I think the important thing that I hear you're doing is you're taking the exam now, right?
Yeah. Hmm.
And that is the best thing to do as well. You're still fresh from your coursework before you have forgotten all those things that you worked so hard to cram into your brain.
Okay. Thank you.
You're welcome. I thought I saw something. Hold on, I'll scroll back up. Yes, Spencer, it still does say that on the website for the LPC. However, unless you right now have all the requirements for the LPC, you still have to get your LPCA, and you don't have the qualifications for that. So again, I'm telling you, if you think you qualify, send them an email. And if they say, yeah, you're fine, be pleasantly surprised. But the way I read the statute for the LPCA is you have to have that clinical mental health internship. There's no way around it. And it's not just me reading that. I've had other people I bounced that off of. The website for the free exam, there is not necessarily a free exam, but there's online practice tests, and some of them might be free, and they might require you to sign up for their email list for one practice test. But most of them want you to pay, Richard, sorry. Oh, Joanna, how might this look virtually? Yes, good question, especially right now. What part of it are you considering? What part are you most curious about virtually?
I think the concern is, I guess, we'd have to find re-enroll in a school, and then doing our internship, finding a clinical, a place to do supervision virtually, I don't know, just some of those. And even I know there's talk about what's happening with exams and what that's looking like. So I'm just curious. I don't know if you have the answer, because this is such uncharted territory for everybody. So I don't know if anybody's had these conversations, but I think there's just talk about this potentially going until January. So is it worth it just to wait till 2021, or is that a process we can start now and just really exploring what that would look like?
Well, as far as we'll start with the exam. I don't know if Pearson is allowing people in, and I would imagine they're not essential. So I would just guess that that's a no for right now. So that might be hard to do. As far as the clinical mental health internship, some universities don't want you doing that online. They want that to be a face-to-face experience. And I get that, that makes sense. Especially if you've not been trained in online counseling. That's a big ask. You're learning how to counsel to begin with, and you're learning how to do distance counseling. That's a lot right there. So you'd have to find out from your university if that's okay or not. Supervision, if you have your LPCA and you're getting your 3,000 hours, supervision can be done virtually right now. That's not a problem. Before this happened, there was some debate as to whether they were going to okay it or not, and I don't think anyone had gotten an answer. But right now, everything's virtual as far as supervision, but everything else is a big I don't know. Sorry. Anyone else have questions?
Hi, it's Jennifer. Sorry, I don't know if you saw my question in there. I had it before the website exam question. That's why I was worried you might not have saw it.
Oh.
I was just curious about if you have any tips for marketing strategies, or if you found that it's difficult as a school counselor to go into clinical.
Marketing to school counselor employers, or marketing to clients, or what?
Marketing to employers as a school counselor looking to be an LPCA or looking to be a clinician.
Okay. What I did, and granted it has changed a little bit, once you pass the NCE or the MCMHC, I probably mangled that, I do it all the time. Once you pass your big exam, you are a nationally certified counselor. That means you get to use the initials NCC after your name. So that there is something you're going to put on your resume, that you're a nationally certified counselor. And then when you're in your interview, you're going to let them know, this is the steps I've taken so far. And actually, once you pass your exam, you're an LPCA if you pay the check. If you graduate, you don't have to pass the exam for that. Sorry, guys. You have to graduate. You can be an LPCA. So you could potentially send out your resumes if you have your LPCA and you have your NCC with those on it. And that's going to show that you do have counseling skills, that you are doing what you need to do.
Good to know.
And bring it up in your interviews. It is super hard in interviews to talk yourself up, but do that. Be a little braggy, because it's the one time it's okay. It's definitely something you want to bring up. What else do we see here? A website to become certified in telemental health. To become certified in telemental health, that's the BCTMH, Board Certified Telemental Health. You need to be a fully licensed counselor. You need to have your LPC. So that's your first step. And that if you go online, it's CCE, the Center for Credentialing and Evaluation, CCE. If you just Google BCTMH, I'll put it in the chat box. It will lead you to the page. And that is the certification for telemental health. That one's been around for a bit. It used to be the DCC, but they changed it. Now it's telemental health and not distant certified counselor. There are some other ones I have seen popping up in recent weeks that they're calling credentials, and I would just advise you to take that with a grain of salt. There is a lot of education out there right now, and some of it free in how to do telemental health, but it's not a certification. Okay, what? The difference between the LPC and the LPCA again, absolutely. Yeah. So, I'll share it with you again if you're a visual person so you can see it. All right, LPCA, you have to have education and $220. That is it. The LPC is what you get after you've going your 3,000 hours. And I'm trying to find that slide, sorry guys. They're not conveniently next to each other. For the LPC, you need education, which you have if you have your LPCA. You need supervision. That's your 3,000 hours of practice where you have 100 hours of one-on-one supervision, and you need to pass one of the exams. Sure, Kristen, I will. Did that answer the question about the difference between the LPC and the LPCA? Okay, good. You're welcome. Any other questions, guys? All right, I'm excited. Is it feasible to do the 600-hour internship in the summer if you're a school counselor? Most schools are going to want you to split it in half, do half one summer and half the next, because there's a lot that goes along with the internship that's not necessarily just the hours that you're doing. There's learning that goes along with it, assignments, discussions. To be an NCC, you do not need to be an LPC, and you do not need to do the 3,000 hours. You need to graduate and take the exam. NCSC, that's a whole nother world. I'm not entirely certain. I don't have that one, sorry. All right, any other questions? We have just a few minutes left, I think. Is there a link for the LPCA? If you go to Google and type CT LPCA, it's going to pop up. I have a question here about maintaining your LPC. What's the question, Anna? I'll do my best. If you have questions as we go along in our profession, who do we get info on what to do next? So if you get stuck and you're not certain what to do, if you have a supervisor, you're going to go to your supervisor and ask them. If you're in taking classes at a university, ask your professor. And well, Jennifer, I know you have my email. You can always email me. Thank you, Billy, for that link. Questions regarding matriculation before 2017 and still getting LPC A without the 600? Yes, that should be directed to the Department of Public Health, because the way the statute reads right now, that exemption went away. I have a question here about the best way to obtain the required PD and CEUs. I can tell you, you should be a member of ACA, because if you are a clinical counselor, that is your organization. You get 12 free every year from them. And those are usually pretty relevant and pretty good. You need to meet your veterans requirement. The VA has online free CEUs. So get those. Where else have I gotten? PESI, P-E-S-I, gives trainings. They're pricey. Some of them are better than others. Some of them are fabulous. If there's a certain thing that you feel like you're weak in or you need to learn more about, then Google that and see what the organizations are around that and see what they recommend. There's lots of different things out there. You're welcome. All right. Last chance. Any other questions? All right. And Suzanne, if you get an answer, please send it to me. I would like to know.
I actually did have one more question.
Sure.
Would you advise that we do the LPCA before the LPC if we already plan to get the LPC?
The way it's set up right now, you need to do the LPCA first, because there's no way to practice to get those 3,000 hours. It's illegal to do that without the LPCA now. It used to be that didn't matter and we were just unlicensed clinicians, but now you have to have your LPCA. Good question. Thank you.
Okay.
It's
thank
confusing.
Dr. Zalewski, oh, did you have one more question? Go ahead.
Yes, one more thing. I'm sorry. Just from the slide that said to get your LPCA, you just need your education and $215. With me graduating this year in school counseling, can I just pay $215 and get that, or is there a step within that?
If your classes that you have taken cover that list of things, and it's on the DPH website,
Okay.
And this will be posted as well for you. If you cover all those things, and like diagnosis and assessment, that's one thing that you need to make certain you have, and professional orientation to mental health counseling. Those are things that aren't usually in school counseling programs, although some of them are. You need to make sure you fit all of those things, because your university is going to have to send information. Paula, you do not need your internship, your clinical mental health internship. Yes, thank you.
All right, thank you very much.
You're welcome.
Great. Dr. Zalewski, thank you so much. We really appreciate you having us here, or you being here today.
Well, I want to thank you for letting me be here. Thank you very much, Kylie and Kathryn, for organizing this. Yay.
Thank you. If anyone has any other ideas of events you would like to see, please don't hesitate to reach out to me or Kathryn. Thank you so much for attending, everyone. And we'll be excuse me, distributing the link later on.
Kathryn, I don't know if you're trying to talk, but we can't hear you.
All right, everyone. Have a good one. Thank you so much.
Thank you.